We are coming live from TENRI Hospital. My name is Washera, and I'm so much enthused this afternoon to host you for the Talk to Your Doctor show that is coming live. Today you'll be having a conversation with our medics who are here at TENRI Hospital. And today I have Dr. Monyoki, who is our medical officer. I also have Motegi, who is our clinical nutritionist, and we are coming live from ENA to talk about diabetes and hypertension, which will be having a clinic tomorrow here at TENRI. A quick reminder is that you can get all the services that you need here at TENRI. If you're sick, you can come anytime for 24 hours. We are open and receive all the services that you need. So today we talk about diabetes and hypertension. You can share this conversation with your friends, with family, and even with your guardians, and they can listen to it. And you can ask all the questions that you have, and our medics will be answering them on time here at TENRI. Karibuni sana to the show and enjoy the show. Karibuni sana daktari.
Thank you very much.
We'll start with the introduction.
Thank you.
You introduce yourself to us. Tell us who you are. Okay. For many years have you practiced medicine? You know, people also would like to know. And then we continue with the show.
Okay, so thank you very much for the opportunity that you've given me.
Yeah.
My name's Dr. Munyoki. I'm a medical officer here at ASEF TENRI. I have practiced medicine for about 6 years now. I finished my internship in late 2019, and from then I've been practicing.
Yeah.
And I've been based at ASEF for about a year. Before that, I was in other TENRI branches.
Yeah.
Yeah, so far I'm based here, and I'm the medical officer.
So what inspired you to do medicine?
What inspired me to do medicine is the urge to serve humanity, and to treat people who suffering from various conditions, so that we improve the general outcome of health in people.
So far, how's it been?
So far it has been great. Yeah, I think so far so good.
Yeah.
No regrets, no complaints.
Okay, thank you, Sana. You're a great medical officer, and we value here at TENRI. Thank you for attending to our patients. I'm sure they love you so much. So we go to Motegi. You can introduce yourself.
Hello, viewers. By the name James Motegi, clinical nutritionist at ENA. I have practiced this field for more than 7 years.
Oh.
So initially I've been working at Majimbo. Now later on I was transferred to here. So I'm very happy to be here. And actually what inspired me to do nutrition is because of those non-communicable diseases and other aspect of malnutrition in children. So that made me to be more proactive on food. Why food is a medicine, why all those things. So welcome to the show, and I hope you're going to enjoy.
So you're telling us food is medicine?
Yes.
Awesome. We go to Dr. Monyoki now. I guess we have a diabetes and hypertension clinic tomorrow on Wednesday. Yeah, TENRI, which is free, where we do a follow-up for patients who are suffering from diabetes and hypertension. And I understand that it is a lifestyle disease. I've seen even a 30-year-old with diabetes. So sometimes you get concerned, because when I was growing up, you used to say diabetes is for old people, but now it has become, rampant all over. So we talk about it. Doctor, you will tell us what is diabetes and what is hypertension, just briefly, because now I know they are wide topics. We can't be able to cover all of them at once, but we can do it briefly, like what is diabetes and what is hypertension.
Okay.
Yes.
So hypertension and diabetes are two common chronic conditions that generally affect people, and in most cases, people might be unaware that they have the underlying disease while they don't. So in definition and simple terms is that hypertension is a medical condition that is characterized by elevated blood pressures of more than 140 systolic and 90 diastolic. And diabetes is a medical condition that is characterized by elevated blood sugar levels in the body. So there are various types and there are various stages, and the signs and symptoms, and even the treatment for both of them, hypertension and diabetes.
Yeah.
Generally, hypertension is when you have elevated blood pressure levels of more than 140, systolic and 90 diastolic, and diabetes, you have elevated blood sugar levels.
So these are brother and sister diseases.
Yeah.
When you have diabetes, you're likely to have hypertension.
You're likely to have, but also depends. You might have one and also fail to have another.
To have the other one.
In some cases, they go hand in hand. You can have both.
Okay.
Hypertension.
Next, we are coming to discuss about the risk factor, but you can go to Mutegi, and Mutegi, you can tell us what is nutrition, what do you do in nutrition, and talk about BMI maybe.
Okay, let's say nutrition starts now with ingestion of food.
Yeah.
When you ingest food, you chew, you swallow. Now that food brings about the nutrients. Now that nutrient gets transmitted to the body, for which promotes growth and the other processes in the body. So when you acquire that energy from food, nutrient from food, all those processes, we can say that is now nutrition, ingestion up to the excretion.
Yeah.
So on the other matter about the BMI, we say it's a body mass index, whereby we take weight and height, and weight in kgs, height in meters squared. Now you divide, you now compute. We have a BMI whereby we say from 5 to 17 years we do set scores. That is, we have a reference chart whereby we see maybe the client is weighing this one, the age, weight for height, all those things. Now the other BMI for adult from 18 and above, whereby we say below 16 kgs per meter squared, you are severely underweight.
Yeah.
Now above that to 18.4, now you are underweight. We severe and the other moderate underweight.
Yeah.
Now from 18.5 to 24.9, now that is a normal BMI. Now from 25 to 29, that is overweight. Above 30, now you are obese. And now those ones, now they are BMI. Yeah. So we have other things where it is whereby we do waist hip ratio, whereby we take the tape measure, just the normal tape measure. We measure from the smallest part of your body around the navel, above the hip joint, and now we do the wide part of the hips. Now we compare. Now the waist circumference for a man, it should be less than 1 or 2 centimeters. Now for the female, it should not be above 8 centimeters. Now when we compute both hip waist ratio, for a man it should not exceed 9.4, 0.94, and now for women at least 8.5 centimeters, 0.85 centimeters. Now that is now when we see maybe your BMI is being affected, and all those indices we try to see how is your weight. And now as far as now the pressure and sugars are concerned, now it tells us now those are the risk factors. One of the risk factor, BMI, a lot of weight, they predisposes you to hypertension and diabetes.
So how are the two correlating, nutrition, diabetes? How do they correlate?
Okay, they are all metabolic disorders. I will say that.
Yeah.
Because one, when you ingest food, when you take food by your mouth, that food is being converted to glucose, the smallest, the simple form of carbohydrates. And that simple form is now the simplest type of nutrient which is taken by the cells. So, and now when you take carbohydrate, now that calls for insulin production from the pancreas to make sure that sugar is not above the normal range, maybe from 3.5 to 7.8. Now, your pancreas has to secrete insulin, so you are able to make sure you make sure that sugar is not above that. But because now, if you produce every time you are producing a lot of insulin, you are eating a lot, maybe taking sugary food, you realize at the end of the day you are converting a lot, and that piling may lead to maybe resistance to the insulin, and now that leads to diabetes. Now about hypertension, you see maybe the cholesterol level in your arteries clogging, all those things. It's like you are you overwhelming the body because of all those energy. So they really relate, and you see the hardening of maybe blood vessels because of maybe sugars. Now you see maybe because of that hardening of those blood arteries, blood vessels, you see maybe there is a lot of restriction because of blood pressure. The heart is pumping, so it gets a lot of restriction from the peripheral. So, and of course blood pressure, you see high blood pressure is a restriction. When the heart pumps, it gets some restrictions peripherally.
Okay.
So they really relate, and we have other risk factors.
All right.
Yeah.
You've told us one of the risk factors is the BMI. So doctor will be telling us other risk factors of these two diseases.
Okay.
Yes.
Yeah, so basically, as James has said a lot about it,
Yeah.
Mostly we take lifestyle modifications, lifestyle changes as one of the risk factors for that.
Yeah.
So the nutritionist has said obesity counts.
Yeah.
And when you calculate BMI and it's high, mostly above 30, that's when now the risk for acquiring both the hypertension and diabetes increase. Yeah. So apart from the weight, excessive weight, other lifestyle issues like excessive alcohol intake, cigarette smoking, taking too much salt in the food that you eat, living a stressful life. Yeah, all those can lead to that.
Yeah.
Can lead to the
to the cause
to the causes
of the diabetes. Yeah.
And diabetes also.
Okay.
Yeah.
So we go to maybe signs and symptoms.
Okay.
Someone comes, you've told us it's a condition that someone may not be knowing they have it. They couldn't be feeling even anything or any pain.
Yeah.
So you can tell us some of the signs and symptoms when someone has hypertension and another person who has diabetes and someone who has both.
Okay.
Yes.
Okay. So we can start with diabetes. Diabetes usually, when patients come to the hospital, they usually complain of excessive thirst, excessive urination.
Yeah.
Some of them have unexplained weight loss. They might also complain of having visual disturbances or blurry vision.
Yeah.
Yeah, some of them might complain of being tired most of the time.
Yeah.
Yeah, for pressure, usually the most common symptom is headache.
Yeah.
They complain of headache, but in some cases they just have no complaints. When they come for other medical conditions or other complaints, we diagnose them with hypertension. Yeah, but mostly headache is a presenting complaint. Some of them chest pain. Yeah, some of them lower limb swelling. Yeah, some of them insomnia. Yeah.
Okay, so that is on for hypertension.
Yeah.
So having those the signs and symptoms, we go to Mutegi. Mutegi will be telling us how do you come in when doctor diagnoses someone that they have hypertension, they have diabetes. Now, when it comes to you, what do you do when a patient is new, he or she has diabetes and hypertension? What do you do?
Okay, thank you, Doctor. As I highlighted those risk factors.
Yes.
And most of the time we deal with risk factors. Now we have modifiable risk factors and non-modifiable risk factors. Now we deal with those modifiable risk factors, like now weight loss. Now that comes like weight loss, diet, exercise. Now diet plays a very big role when it comes to management of diabetes, whereby we want to make sure, our aim is to make sure the sugar are near normal, and that is why we start now portioning diet, making sure there's a right amount of carbohydrate ingested, there's an amount of fat. That is why you see a lot of fat in the body leading to resistance.
Yeah.
So we are going to be with doctor here and prescribe some medicine to help with the fat. And in my part, I will try to take a step ahead of trying to calculate amount of fat you need to take per day, amount of proteins you need to take per day, amount of fruit and all those things. Because when we take food, and food is for energy.
Yeah.
But now, maybe you are overweight. We need to make sure you lose that weight.
Yeah, sure.
But are you active? So we try to incorporate all those things, your activity, activeness, and when you do those those exercises, you promote like insulin secretion, try to promote now the muscles to have that uptake, now, and you promote the sensitivity of that insulin to the cells to the insulin.
Yes.
Because now when you take food, insulin acts as a key to open the sugar from the blood to enter into the cells. So, and in most cases, you find that there's a resistance.
Yeah.
So I have to make sure that sugar which comes from food, it's not too much. Because now when you take a lot of food, it means now the sugar will go up. So I have to make sure I control sugar intake, and those I deal with the complex carbohydrates. Because when you take sugar, simple sugar like soda, juice, cakes, it means now the sugar assimilation or absorption of sugar will be very fast. But now when you take a complex carbohydrate, it means now the sugar will just be released very slowly. And now that is what we want. We observe portion, and then the complexity and the simplicity of the carbohydrates. Now we do other things like proteins, we also portion, because as you take a lot of proteins, it means you are taking even fat, and we give a lot of vegetables. They act as a buffer. So you are going to release very little sugar slowly. And now that is our aim. We don't want to make sure sugars are high, and that is where now we work hand in hand with doctor here.
Okay.
Yeah.
So that is treatment in nutrition.
Yes.
And then there's the medicine part of it, the
Yes.
treatment. Doctor, you can tell us. I'll be coming back to you. You tell me. There's some people have been asking me, if I eat this, will blood pressure go down? So doctor, you can tell us the treatment you take our patients through when they come to the hospital, the medication and the treatment process.
Okay.
Yes.
Okay. So first of all, for hypertension and diabetes, we usually advocate for the nutritionist to start with the counseling for these patients. The nutritionist will play a part in counseling the patient so as to change the lifestyle. If he's a chronic alcoholic, we'll have to advise him. If it's poor eating habits, the nutritionist will intervene. So first of all, if that one has been taken, we'll have to introduce the treatment for the patient. We mostly have various classes for treating both the hypertension and diabetes. And it depends on the stage or also the levels of both the blood sugars and the blood pressures. So we have various medicines that can treat both hypertension and diabetes, and also for the sugars we have various classes to treat. Depending on how the sugar control is, and also the tests that we do, we'll initiate the treatment.
So a first-time person coming to the hospital, it's the first time they are being told. I understand there are different treatment depending on maybe it's the first time, or there are some who have been on medication, you reduce the medication. How is that process of someone coming maybe to have three medicine in the morning to having one in the morning after some times? How does it go?
Okay. The process of adjusting the medications goes in such a way that we usually monitor. We have a sugar control test that we do to see how the sugar control was. We can control that also via criteria to check the sugar control, to check the urine, and to check the blood level for that patient. We have two types of diabetes, type 1 diabetes, type 2 diabetes. For type 1, you usually manage with insulin.
Yeah.
For type 2, usually it is a disease that has its onset from above the years of 35,
Yeah.
and mostly older people.
Okay.
So that one we can manage with some oral types of medication as we control the sugar level and the sugar control.
Yeah.
Yeah, and also the effect this disease can have on end organs, can be able to adjust and to titrate the medication. Yeah.
These two diseases, Doc, they are leading people to have kidney failure, failing organs. Why does it happen? Why does it get to that level? The kidney failing, of some parts of the liver failing. What makes this condition get to that?
Yeah, it's the pathophysiology, the pathophysiology for the disease. Usually when the levels are high for the pressure and for the blood sugar, they target end organs and they're going to damage the end organs.
Okay.
Yeah, and for diabetes, for example, we have what we call microvascular complications.
Yeah.
You can also have macrovascular. Microvascular is the small vessel disease that can affect the nerves, the kidneys, and the eyes. Yeah, for macrovascular now you can have people having strokes or heart disease. You can even have peripheral vascular disease, or even gangrene, wounds in the feet. Yeah, so depending on the levels of the blood sugar and the blood pressure, they target the end organs and they can cause damage. Yeah, that's why complications happen.
Yeah. So people should take medication very seriously once they have been diagnosed, because watu wanasema nimerogwa. You know, people have that tendencies of saying a lot of things and not taking medication seriously, or someone comes to the hospital and tells you nilisahau kukunywa dawa. Someone takes another medication just because in your pressure and what have you. So people to take treatment. Is there a possibility of getting healed?
There's some possibility of getting healed.
Oh, nice.
Yeah, there's some possibility. I've had a couple of patients who actually have healed from hypertension and diabetes, and we just follow. So usually if they adhere to lifestyle modification, lifestyle changes, they adhere to medication, at some point find that everything
goes down to normal.
Yeah.
Oh, so there's hope.
Yeah, there is hope, though for a small percentage.
A small percentage
of serious people.
Which age? All it's the whole age, maybe which age have the likeliness of? Because I heard when you get to 60, there's a condition you have to live with forever. So
yeah, mostly I've seen between 40 to 50. Yeah, in the patients who are serious in taking medication and following what we do. Yeah, they have the pressures and sugars well controlled. Okay. Yeah.
Nice one. We can go to Mutegi. Which are these foods? When someone has come to the TENRI, they'll be told now you have to go through this medication, you'll be taking this, you'll be having insulin, you'll be taking this medication for hypertension. Now some calls and they ask you, can I take a low egg, which is not cooked? I've been told it can lower the blood pressure. Someone asked me another day, I've been told to take okra water. Can it lower blood pressure? So what are these foods that can help? You know, there are these foods people want to eat, maybe they want to hear, and they have it in their homes. What are these foods? Or is it a myth to have okra water that it can lower blood pressure?
Okay, thank you very much. Okay, for diabetic patient, there is no specific diet for diabetic patient. Yeah. Just take the normal diet, but what you need to know, just the portion according to you, according to the weight, according to the blood levels of your blood sugar levels. So you have to can enjoy any type of meal, but what you need to know, there are those empty caloric diet like juices, like soda, like cakes, which we know they are very simple when it comes to digestion in the body. So you can have githeri, you can have mukimo, you can have chapati, but now you make sure you observe their quantities. So you don't feel bad, maybe you are isolated, you are not eating this. You can eat anything, but now how much energy do you require per day? What is your activity factor? What are you doing? Because when you accumulate a lot of energy, remember that energy, that the one which gives you a lot of weight, and now that weight becomes a risk factor. So for when you have now that resistance of the insulin, maybe you're on medication. Now we start you with maybe low carbs, carbohydrates.
Yeah.
Now mostly complex carbohydrates, which releases sugar very little. So you have to enjoy any type of.
So
you have to eat meat. But now this issue of you are taking empty caloric diet. Mostly we see is Coke Zero. Those ones are market language. So there is no like those who take alcohol. I can say about alcohol, there's no specific amount of alcohol which is recommended for people who is having diabetes and hypertension. So even WHO.
I can cut you short because before I forget this, you've said there are diets with lower carbs. What are these foods? You know, people need to know the foods which have these. Yeah.
Basically, those are whole meal. They are not processed. They are not refined. So, like as earlier I mentioned, like githeri, ugali, which is mainly milled directly from the shamba.
Yeah.
It is whole. For a whole meal, it has bran, it has jam, it has endosperm.
Yes.
So it is not processed, not refined. It is whole. So that means now when you take that whole meal, it has all components. It has fiber, and now the sugar release will be very slow.
Yeah.
And our aim is to make sure that sugar is not surging up very fast.
Yeah, sure.
And then there's that power of distribution. So don't take a lot. Just small frequent meals. That one will help you a lot. So there's no specific diet for this one. This okra will lower sugar. This one will do this. Now for hypertension, we need to lower the salt intake because that is the first thing we talk to the patient because there are people who add a lot of salt and before even you taste you put that salt.
Yeah, sure.
So the recommendation per day at least 1 teaspoon, that's small teaspoon per day, which is about 2300 milligrams per day. So in other ones, you pinch. Don't add a lot of salt. And now that issue of sea salt, it is all over. Provided it's a sodium chloride, you have to make sure you're on that recommended amount. So don't say it's a sea salt, you are putting a much. Unless you know maybe the potassium, sodium, they are different and you are very much aware that the sodium is very low, the potassium is a bit high.
Yeah.
So other foods which helps in like treating hypertension as you combine with the medicine is the high potassium rich diet. So potassium will help that pump of electron pump with the sodium. They try to lower the sodium.
Yeah.
That is why I recommend for fruits, vegetables like bananas. But now for if you have diabetes, there are those fruits even which are have high glycemic index. So like ripe bananas, that one can raise sugar like 4 to 6 units.
Oh.
So
once you eat one.
That serving, serving, like watermelon, like mangoes. So when sugars are very high, we try to squeeze your portions, and sometimes we tell you not to eat this one until now your sugars go to this level. So we need to make sure we combine.
Okay. Okay, nice one. We go to Doc. We've always said that prevention is better than cure, and people would like to know, how do I prevent diabetes? How do I prevent myself from getting hypertension? So you can tell us the preventative measures of these two diseases.
Yeah, okay. The preventative measures are usually based on the lifestyle of people.
Yeah.
Although according to the types, for example, now diabetes, if it's type 1, now there's what you call insulin deficiency. So the patient has to be on insulin as it checks on the diet and the lifestyle. So lifestyle management and modification is very important. For people who take excessive alcohol, it will be advisable to stop or reduce the quantities of alcohol that they take. As the nutritionist has said, also excessive salt intake cigarette smoking,
Yes.
living a stressful life, lack of physical activity, obesity, all those. Yeah, it's good to check on that, to be physically active, to prevent stress, to eat well, to exercise, yeah, to avoid alcohol, cigarettes, and all those. They all help in preventing
The
the
diseases.
onset of the disease. Yeah.
Stress is something that anyone can't avoid. I know even you at some point you've had stress. So
Yeah.
maybe you can tell people, how do they manage stress? How are they able to cope up with that level of, maybe I'm so stressed? How are they able to manage the stress that you don't get to? Because I know some people come with high blood pressures is because of stress. And
Because of stress.
after the stress goes
Yeah,
down,
yeah,
it goes down.
yeah.
So how do they manage
Okay.
stress?
Well, of course, stress is not an easy thing to avoid.
Yeah.
Sometimes most people get stressed. Yeah, even most people in the medical field, yeah, go through stress. Yeah, but what we advocate for is that they bring their complaints to us. Yeah, usually we can take them through a counselor, counseling. Yeah, so as to teach them how to prevent some of the causes that can lead to them having stress.
Okay.
Yeah, and also now the effect of that on hypertension and diabetes. It's very important because most of them, if it's diabetics and they're stressed, they come here with high blood sugars. Some of them with hypertension, they come with high blood pressures.
Yeah.
Yeah, so we need to counsel them
Yeah.
so as to avoid the triggers that
Yeah.
can lead to stress.
To stress.
Yeah.
Some people are taking alcohol here around and they're saying, daktari unasema nini wewe? What do you tell
Yeah.
those people?
Yeah, even that one, if it's hard for them to leave that,
Yeah.
we can also take them through addiction counseling. Yeah, addiction counseling to help them to cut down on alcohol
Yes.
and also to maybe to stop alcohol. Yeah, so we have all forms of therapy
Yeah.
that we can use to help the patients in all areas of life.
Okay. Nice one. We go to Motegi. This lifestyle, we've talked of lifestyle being one of the things that is making people have diabetes and hypertension. So from your nutrition part, there's part of exercise. Mtu anatoka kwa nyumba, anaingia kwa gari, anaenda anaketi kwa ofisi the whole day. You see, that's a lifestyle. That's a lifestyle of that person. And that could be a risk of them getting blood pressure. So how do you help people? Maybe in exercises, or what are they supposed to do, those people like that?
Okay, thank you very much. Okay, in this world, it's moving very fast.
Add,
okay.
Also in that, you can also add someone who is stressed. What are some of the exercises they're supposed to do so that maybe they release the stress also? Yes.
Thank you very much. I'm saying the world is moving very fast.
Yes.
The servers are moving very fast. Now we are always very, very busy, but not active. So there is a big difference between being very busy and being active.
Yeah.
Now, we need to create time. For you to work out, you have to be disciplined. You have to have that consistency. Otherwise, you have to take that responsibility of you creating time.
Yeah.
Now, we have several types of exercises, whereby it also depends with your age, and maybe you have other issues like issue to do with the heart. So we tailor our exercise, we individualize according to your age, and maybe you have any other maybe comorbidity or the other condition. Now, we recommend for cardio exercise, which involves your chest. And now that one, the youth, mostly those under 40, you can do chest or cardio. It helps a lot. Now, when you work out, you start now burning fat, because for you to exercise, don't tell me maybe you don't have a house help, you cook alone, you wash your hair. That one is normal. That's those normal activities. For you to say you are of exercised, it should be intentional. You must feel now the heart rate, the heart rate is high. Now maybe you sweat, you feel maybe the muscles are So you have to create time. At least that to 1 hour per day, and at least 3 days in 1 week. So you have to find a way to make sure you burn calories. You can maybe walk. For those who goes to the church, you can join the praise and worship. Those who go for Zumba, those aerobics, you can do all those things. And now they help a lot. Actually, when you exercise, you promote now the insulin uptake. So when your muscles are you subject them to exercise, they become now sensitive. Because at times you may be producing insulin, but now there is that sensitivity. The body is not recognizing the insulin. So when you exercise, you may find maybe the sugars are even normalizing. Now for the mental strength, when you exercise, of course, you do workouts in the morning, in the evening you do all those things. You find even the mental strength, you are okay on the mental strength. So you're able to absorb these shocks, which mainly brings about the stress. So exercise is better than going to take maybe alcohol. For alcohol, it impairs in judgment. So you don't get healed about this. You just forget, like you lie to yourself, you're okay. But after maybe the alcohol has gone, maybe you find now you are in the same use. But now when you work out, you lift, that one can help you very much. So it's good to exercise and at least 3 days in 1 week, or that to 1 hour per day.
You can talk to us as we're winding up briefly on processed food. We talked of whole meal foods as one of the foods that makes blood pressure comes down and also diabetes. So talk to us about processed foods and the risk maybe of using processed foods.
Okay, processed food, it means now that food has gone to a certain process, and maybe some of the nutrients, some of the additions have been done, and that food becomes now the example of that food. So it's a fruit juice. It's not that it is not a fruit. It is an example of a fruit. So whereby most of those processed food, we call them empty calorie, because they provide a lot of energy, which is not necessary. Like example, let me say soda, cakes, juices, they provide a lot of energy, but at the end of the day, they don't have that vitamin. So you are getting a lot of energy, whereby maybe because of how busy we are nowadays, we are not able to burn those that energy, that is a lot of energy. And that burning of energy will lead to maybe fat accumulation, they affect the insulin, and a lot of fat may clog the blood vessels. Now, that is why we are saying processed food gets into your blood very fast. And now you may find even you getting a lot of weight very fast, because once you take it, gets processed, it gets converted very fast. So the body converts into glycogen, and you find now those processed food may have issues. Another thing, those processed food, most of them are added like sodium, that is salt. So you find even you take something, you don't even need to add salt. It is there already. Like sausages, those you find now they are canned food, they are handled salt. And that salt, we have said, it's detrimental to your health. So they find now that you have edema in your legs, the blood pressure is not being controlled even because of that. A lot of sodium in the system, and now you are overloading the kidneys. So processed food is not recommended for those people with diabetes, people with hypertension. And remember, you are what you eat. So whatever you eat dictates your tomorrow. So you are what you eat.
You are what you eat. Okay, Dr. Ray, you've been in the room for for more than 6 years now.
Yeah.
So you can tell us the numbers. I know they have been increasing day by day, because I was looking at some research and I was saying that the numbers are increasing every day, especially in urban areas, not even in the rural areas. When we used to say the old people live in the rural areas and they are the people who get these diseases. The urban areas, people are getting these diseases. So you being in the room, seeing patient per day, I'm sure every day you see a patient who has diabetes or hypertension. What are you telling people, and how can they prevent themselves? How can they take care of themselves with your experience? What are you telling people?
Yeah, okay. With my experience,
Yes.
I think it's good that we create awareness to the people.
Yeah.
Most of them who don't know that they have hypertension or diabetes.
Yes.
And some of them even come when it's late.
Yes.
When you have complications, that's when people come. I think it's good that we create awareness.
Yes.
We can be having camps and calling people to come for screening and follow-up.
Yes.
And so that we check on them just for free during the camps, and then we counsel them on how to prevent and also manage some of these diseases. Yeah, so I think it's good that we create awareness. We'll be holding camps so that people are aware that they need to get checked.
Yeah. So people
and screen for hypertension and diabetes.
Yes. So people should know that they can be treated and they get healed fully. You know, there was this myth, ukipata hypertension, nivo. So you can tell them about, you know, the healing part of these two diseases. Yes.
Yeah. Now the healing part will come when the patient is compliant on what we do, compliant on the medications, compliant on having the lifestyle changed.
Yes.
Yeah, constant follow-up.
Yes.
And as you do that, most of the patients, you see that they do very well.
Yeah.
Yeah. So you find a very small percentage of people tend to recover from this.
Okay.
But mostly we'll advocate for compliance and also follow-up.
Yes.
Yeah, so that we manage them.
Okay. Next one. Mutangi, we are winding up. What are your final remarks? You know, we can't talk about everything about these things because they are very deep. We can't finish up today. I know another day you will come here and you show us those exercises. Like, we want to see what are those cardio things you're talking about and you want to see them. So you'll come and have a show showing us the exercise you're supposed to do. Yes, and that's the day you come like sporty, yeah?
Okay.
And then we can maybe get those. So what are your final remarks on this show and this topic?
What I can say is that when the diet plays a very big role, and now it poses a big advantage where you when you fall to the latter. So, and now our aim for diet is to make sure the sugars are near or normal.
Yes.
So when you are there to the portions, you are there to the diet, you have that discipline, you have the consistency, you are going to have even less medicine. Yeah. So that is why I would say as my final remarks, when the diet is wrong, medicine is of no use.
Yes.
When the diet is right, medicine is of no need. Yes.
Oh, nice one. Awesome. So food is medicine. As people are taking food, they should know food is medicine. And I understand most of us are obese, like me maybe. I think I'm supposed to go through some...
No problem. When you are, even if you are obese, but now you are active. Yes. Now that one, it's okay than not being active. So take time, even if it is 30 minutes per day, in the evening, and before you come to the work, you can do something. Aerobics, Zumba, you can close your room, you just dance, but provided you are sweating, that one is good.
That is okay.
Yes.
Oh, so next one, I'll try that myself. And thank you guys for coming for the show. It has been a pleasure hosting you. It has been a great conversation. I'm happy. I'm sure the people watching, our clients, our friends and our colleagues are very happy about this show. I can see most people saying here, good job team, a good presentation. So many people are following up this conversation because they have guidance. Maybe they know they have these diseases. And thank you all for coming for the show. Thank you for taking care of our patient, and thank you for everything you do to our patient. We appreciate you from outside here, because I know I'm one of your clients also. I come for treatment, like I'll be coming for treatment later. So asanteni sana. We'll come here again to talk about something else, so that we can educate and inform people out there, because we always say that prevention is better than cure. Dear viewers, thank you so much for watching this show. It has been a pleasure having you here with our medics. Thank you for your interactions. Thank you for everything. And tomorrow we are reminding you that we are having a diabetes and hypertension clinic here at ENA, so you can tell someone that you know they are suffering from these diseases. And we are grateful for always following this show, Talk to Your Doctor show. I'm enthused. I'm Washera. Thank you so much for watching. Until next time, you can keep asking all the questions that you have, and you can talk to us through our numbers that are running down there in the screen. Thank you so much for watching. Until next time, you can